right now. So we got the results of the liver biopsy
Right.
back, and it showed it was breast cancer in the liver.
Right.
So it's metastatic breast cancer.
Right.
And stage 4 disease.
Right.
Stage 4 disease means that, in 2020, there's a lot of research in breast cancer. It's still not curable at stage 4, but it's treatable. And our goals of treatment for stage 4 breast cancer are a couple things. One, if you're having symptoms from the breast cancer, the treatment should help to reduce those symptoms. So if one's having pain or something like that, it improves that. Also, we'd want to improve quality of life that you have, right? The third is that we are trying to extend your life by giving treatment. Now, big question is, what treatment can we give? That largely depends on the hormone status and the HER2 status, or that other protein on the surface of the breast cancer cell. So when they looked at your breast cancer,
I tried to read this myself, by the way.
Yeah, so this was the liver mass. They took the chunk of tissue out. So it says malignant neoplasm consistent with metastasis from known mammary primary.
Right.
That just means it's metastatic breast cancer in the liver.
Right.
This part is showing that the other normal liver is okay.
Right.
Okay. This is sort of the meat and potatoes of what we need.
Right.
So it's the estrogen receptor, checking for the progesterone receptor, and checking for HER2.
Yep.
The estrogen receptor was negative.
Yep.
The progesterone receptor was negative.
Yep.
And the HER2 was negative.
Yeah, triple negative.
This is something
That's
called
what I
triple
thought.
negative breast cancer.
You can give me a job because I read the report, right?
You did.
Sorry, I'm trying to make light of it. So the worst.
Definitely the least favorable. And what does that mean? So if the hormone receptors have been positive, it has a better prognosis, right? Triple negative breast cancers tend to be more aggressive, and the prognosis is worse.
Right.
What this means in terms of treatment is that the mainstay of treatment for triple negative breast cancer, and we'll get deeper into that, it's just sort of the overarching statement, is chemotherapy. And it's usually chemotherapy, single agent chemotherapy, given for a time. We check CTs and bone scans to see if the chemotherapy is working after about 2 months. If it's working, we continue the same chemotherapy. Check scans again in 2 months. Keep doing this. Eventually, though, by the nature of triple negative breast cancer, the breast cancer will start to grow even though you're on chemotherapy. At that point, we would switch to another therapy. And we keep doing that indefinitely. Big picture. Now we funnel down. For triple negative breast cancer, another thing we have to check. Hold on, let me go grab some tissues in the next room. You don't have to actually a box here. Now for triple negative breast cancer.
Right.
We always check if the tumor expresses PD-L1.
Okay.
Do you know what that is?
No.
So have you seen commercials for Keytruda or Opdivo?
Yes.
So that's what it is.
Okay.
So tumor cells have this receptor on, or it's actually the ligand, and the receptor's on the, I guess, white blood cells. But the point is, immunotherapy works to try and block the interaction between this PD-L1 ligand and the actual programmed death receptor PD. And by doing that, it kind of helps your own body's immune system to work better and fight and kill the cancer cells. For triple-negative breast cancer, there was a recent drug approval by the Food and Drug Administration with a combination of therapy called Abraxane, which is a chemotherapy, and atezolizumab, which is immunotherapy.
Okay.
This combination of medication in patients whose tumor is positive for PD-L1 showed a statistically significant improvement in progression-free survival. What does that mean? The interval of time that the cancer was at least stable and didn't grow. They took in this clinical trial patients and gave them either chemo, the Abraxane by itself, or gave them Abraxane and atezolizumab, the two agents together. These patients over here who got both agents, I think their progression-free survival was about 7.5 months. Over here, just chemo was 5 months. So it was a 2-month difference. People may say, oh, 2 months isn't that great, right? But what they actually just presented in late September is that the overall survival in the patients whose tumors expressed PD-L1, who received the chemotherapy and immunotherapy, was about 7.5 months longer than the patients who just got chemotherapy alone. I say all this to say that I already asked the pathologist when this came back to check the tumor for the PD-L1 status. If it is positive, then I'll recommend, and we'll print out all this information for you and give it to you before you leave, I'll recommend that you get Abraxane, which is a chemotherapy, and we'll go over side effects, and atezolizumab, which is the immunotherapy.
That was one of my questions, okay.
Yeah, so that's standard of care, what you would get if you go anywhere for treatment.
Mm-hmm.
Another thing that I asked the pathologist to do is to check to see if there was enough tissue such that we could send the tissue for next generation sequencing. What does that mean? That's where we send the tissue off to a company called Caris, and they look if there's any genetic mutations within the tissue itself, because sometimes if there's mutations in the tumor, it gives rise to clinical trials you could be on, meaning cancer therapy drugs or drugs that are in development. They're not approved for any cancer yet, but they've seen some promise, and so they're going through a clinical trial process.
Mm-hmm.
Also, there's, I guess, one sort of drug, which is a pill, which has been approved from the FDA for any metastatic cancer that has a certain gene fusion. Very low likelihood of that happening in breast cancer, but that's something that the next generation sequencing would check for.
Okay.
We don't need to hold therapy to wait for the next generation sequencing results.
Right.
Because it takes about 2 to 3 weeks to get those results.
Okay.
And if there's a mutation in these results, like in the tumor tissue, then we would have to enroll in a clinical trial, and that takes time anyway. So we wouldn't wait for all that to come back, but we're doing these things, I guess, concurrently, so that you'll still be getting treatment. We'll check on these on the tumor genetics, essentially, and see if that opens up any other treatment options.
Okay.
Now you may ask, what happens if the tumor does not express PD-L1?
Right.
The options at that point are to start chemotherapy, and I would suggest and we'll get into this as we get through the conversation, it would either be a paclitaxel chemotherapy or an Abraxane, which would be the same chemo that you would have received if the tumor is positive for PD-L1.
Got it.
And then we would just continue chemotherapy until it's not working anymore. Now, this is standard of care. Another option we would have is enrollment in a clinical trial. Here at this institution at Georgetown, the clinical trials that we currently have available for patients with metastatic triple-negative breast cancer are only for if the patient has already had experienced disease progression on a chemotherapy. So you haven't had any chemo yet, so you don't qualify for that, right? But what we could do is look on the clinicaltrials.gov website and see if there's another clinical trial in the area for patients who have triple negative breast cancer who haven't yet received treatment.
Mm-hmm.
We do sort of need to wait for the PDL1 status
Mm-hmm.
because that determines
Mm-hmm.
exactly which chemotherapy drugs we would start with.
Okay. How long does the PDL take?
A couple days.
Oh, okay.
I requested it, I think last week when this came back. So we should have it in the next few days. I was hoping we'd have it today.
Yeah,
I had
sure.
emailed them yesterday. I was
Okay.
very helpful, but I couldn't control
Yeah,
how
sure.
fast they do that.
And then I know the last time we talked and I did some research that
Uh-huh.
there's a test where you can see how the rate of the growth. There's some pathology
Oh, like
test.
KI67.
Yeah, the technical term.
Yeah, so it's the KI67. It says sort of how proliferative or how quickly growing
Right,
it is.
exactly.
And I don't believe they did it here because they typically don't do it on metastatic sites.
Oh.
They only really do it on the primary breast tumor.
Oh, I see.
And they don't do it on lymph nodes or other sites. But because it's triple negative, I know that it's going to be more aggressive.
Like what does that mean?
So in terms of the natural trajectory of triple negative breast cancer is, we start a therapy, we get some mileage out of it. When it's time to switch to the next chemo, just by the nature of the disease, most patients get less mileage or less time from when they need to switch to another one because the tumor would have grown on that chemotherapy. And the further along we get, the more chemotherapy your body gets for the cancer, the shorter interval of response, the farther we get down the road.
So why do the
Because
chemo?
tumor adapts to it.
Exactly. The tumor develops either some type of resistant mechanism, a whole, bevy of things that happen. Why do it, you say? Because it's extending life, essentially. If we didn't do treatment, then I think the sort of life expectancy would be certainly less than 6 months.
Are you serious?
Now, I don't have a crystal ball. A good thing is that there's small disease in the liver, right? If the disease burden was larger, then it would make that number slightly less. And in 6 months, it could be longer because the disease burden is small, right? But numbers-wise, if we don't do any treatment, it'd be somewhere around that order. You're young. I would not recommend that we don't do any treatment. I would definitely recommend that we treat you and
I'm sorry.
treat the cancer.
And if we treat, was it the 3 years?
So that would be for the hormone receptor positive, okay? For triple negative with treatment, the median, meaning if we drew a little bell curve and put a line straight through the center, median means 50% of patients are alive at 13 months and 50% of patients are not.
Oh my god.
I know this is overwhelming and it's tough. And I know you have children. And I really want to have our social worker call.
Oh my god. I'm sorry.
No, you should react. This is tough news to take. This is not. Do whatever you have to do.
Like, why was it the estrogen receptor when it was here, but now it's triple negative? We don't know.
From a science perspective, but that's exactly why when a patient has metastatic disease that we read to a biopsy and look, because in about, I would say 10 to 20% of time, those receptor markers have changed.
Yeah, I read that.
and it makes a difference
No one
in
knows
terms
why.
of treatment. Yeah, we don't know why.
With the treatment, you said how long?
Oh, I'm sorry.
With the treatment, you said how long?
Median, 13 months or so.
I can't breathe, oh my god. Noah's 8 years old.
These are just stats,
I
right?
know.
So, but I think it helps for patients to hear.
I just don't know how to live with it every day yet. I just haven't figured it out. So I do need the social worker.
Yeah, I'm gonna have, her name's Rachel Rass. I'll have her call you maybe this afternoon or tomorrow.
Please,
maybe,
thank you.
Maybe we can give you till tomorrow so you can take it all in today.
Yeah, thank you.
But she has resources that'd be available to help
Yeah.
talk to your kids about what's happening, what's to
She's
come.
already-
So I've been having a pain right here.
Uh-huh.
Is it pain because I know that I have liver cancer in the liver, or is it real pain?
Is it in the, hold
And
on,
sometimes it pops out, which I was told.
pops out?
Yeah,
Like here?
right, like right here.
Right there. So that's below the rib. So it could be, I'll look at the imaging with the radiologist to see, sometimes the tumors,
It's like a dull,
Push.
sharp pain.
yeah, sometimes they can push on the capsule or lining of the liver and that causes pain.
Cause it feels like when I was pregnant and the foot would go up there.
Oh, yeah, so it could be the tumors pushing on the capsule,
Yeah.
but I'll look at the imaging with the radiologist and see if they think. Because what we should do, in case it is like an actual rib pain, is that we're gonna order a bone scan. On the CT,
I mean, I knew that, but I didn't think it was.
they didn't think there was anything, no suspicious lesions on the CT. But based on the size of the tumors in the liver, I would think they're not big enough
Right,
yet
to
be
hurt,
causing,
right.
yeah. So we need to get a bone scan and see if there's any ribs that are maybe
Do you order that or
affected.
does?
Yeah, I'm gonna order it here.
So we're not, okay, so we're waiting for the PDL
One status.
and to determine which chemo.
Right,
What are the
because.
side effects of the chemo?
Right. So with the Abraxane, let's say, we'll first talk about if it's PD-L1 positive. If the tumor expresses PD-L1, you get Abraxane and atezolizumab. Side effects of atezolizumab are sort of quicker and easier to go over. So immunotherapy can cause itis of any sort of organ system. Itis meaning inflammation. So it can cause pneumonitis, inflammation of the lung. That would manifest as a dry cough and shortness of breath. So whenever we go through chemo, we see you before each cycle and ask you if you have symptoms. If you were to say, oh, I'm having a new cough, then I would send you for a chest CT. It can cause hepatitis or inflammation of the liver. We would see that with the labs we get before each cycle. And there's certain dose adjustments and things that can be made to work with that. It can cause dermatitis or rash of the skin. It can cause hypophysitis, which is inflammation of the pituitary in the brain. That would manifest as a headache. That's not going away. Rarely, it can cause like nephritis or inflammation of the skin. Very rarely, it could cause a myocarditis or inflammation around the heart. It can cause a colitis or inflammation of the colon. That would manifest with abdominal pain and diarrhea. Often, immunotherapy can affect the thyroid, and it can cause usually hypothyroidism. But we monitor that with all the labs and get the thyroid studies about every 6 weeks or so, and if needy, we put you on medication if we have to.
Do people pass from chemo, right? Pass away, die.
They could, but not so directly from the chemo, right? So the chemotherapy side effects from Abraxane, the major one we look out for is something called bone marrow suppression. bone marrow is where your white blood cells, red blood cells, and platelets are made. You need the white blood cells to fight infection. You need your red blood cells to carry oxygen and nutrients to all your body parts. You need your platelets to help you clot if you were to get cut, right? The chemotherapy can cause your bone marrow not to work as well. So you have less of those floating in your body. Why is that important? If your white count is low, that puts you at increased risk for infection. If your white count, we particularly look at the neutrophils, which are a little subsection of the white cells. If they go,
I just realized I don't have my mask on.
oh yeah, I
Sorry.
didn't realize either. Okay. If they go very low, below 500 or even 1,000, then you have something called neutropenia. If you were to get a fever, anytime you're on chemo, if you get a temperature greater than 100.4, so 100.4, if it's in the daytime, you give us a call here at clinic. Depending on where you are in the chemo cycle, we'll know what our suspicion is that your white count is low, and we either send you to the emergency room to get antibiotics and blood cultures and such. If it's overnight, there's an overnight number you call. So getting back to your question about people passing from chemo, it's because they would have maybe gotten an infection,
Right.
from having a low white blood cell
Right.
count. Or they would have had some untoward, like if the colitis got really
Right.
bad and caused a perf. Not saying this happened,
Right,
but
right,
these
right,
are
right.
like
Right.
sort of secondary reasons why people
Right.
could die from
Okay.
chemo.
It just seemed like, because I know 2 women who had breast cancer at the same time I did 5 years ago. They did chemo and they're both gone now.
And it could unfortunately be just that the disease progressed too. Another important side effects is numbness and tingling in the fingers and toes called neuropathy, alopecia or hair loss, nausea. Hopefully not much in the way of vomiting because we have very good anti-vomiting medicines now. And when you come in to get treatment, then you get those in infusion, and we also will give you nausea pills that you will take when you get home. We can take a breather.
It's okay. It's okay. Unless I'm making you uncomfortable.
No, not at all.
Okay, so it's the drip type of chemo, both of
Yeah,
them.
both of them will be
And it's here.
IV. So what would happen is you come into clinic, I see you, we get blood work, make sure everything's okay, then we send you to the ground floor of the Bless building, which you probably haven't been in yet, but we'll show you how to get there. And you would get the chemotherapy down there, okay? And that would be for all of the
Can I drive?
you can, however, for the first infusion, we recommend that someone else picks you up so that we can see how you tolerate it. If you tolerate it fine, then it could be okay for the
How
supplement.
long is the?
That part we have to ask. It'll be several hours, and I don't know the exact,
We didn't remember when I'm not with you, but
the exact,
several hours, you said?
yeah, time.
2 to 3 hours.
Yeah, sometimes, yeah, it can be.
And women can work during all this?
You can, however, what work do you do?
I work for the IRS, I do cybersecurity.
So
And
you're
she
at
does
home?
telework,
Yeah.
Yeah, so that's good, because, if you have to go back into the office, we
Right.
would just give you a note saying you shouldn't go back into
Perfect.
the office. Yeah.
Okay.
Mostly for infection.
Right.
Mhm.
For
Yeah,
exposure,
mostly because of infection
Well,
and
that's
with
good.
COVID and whatnot
Sure.
going on. I
Most
don't
people
think
I
that
know
would be.
work from.
Mm-hmm.
Yeah, I work from home anyway. so,
Yeah.
Okay.
Once you get it, right, you'll see how you feel after the first infusion, and then that'll let you know sort of what you can do going forward.
Got it.
But sometimes women are, understandably fatigued, and you may have some nausea for the first few days after. So, if it's PD-L1 positive,
Right.
we give you Abraxane and Atezolizumab.
And those
The
are both
site-
drips.
They're both IVs.
Okay.
The cycle. So chemotherapies are given in cycles.